Hello, my name is Phillip Montgomery, and on behalf of CBIA, I thank you for joining us on this webinar, which will provide you guidance on helping workers and employers stay healthy during the current pandemic. We are very pleased to have as our presenter Ken Tucker, the Director of CONN-OSHA, a division of the State of Connecticut Labor Department. Ken was appointed to his current position in 2012 and has been with the Department of Labor since 1986, beginning as an occupational hygienist, working as a health compliance officer in the public sector. In 2004, he was promoted to the position of an occupational health and safety manager. In this role, Ken was responsible for coordinating efforts in both the public and private sectors. Ken has spent his professional career in the field of safety and health, beginning in 1974 as an enlisted member of the United States Air Force, with whom he served 2 enlistments, having the responsibility for the safety and health of base military personnel. Please join me in welcoming Ken Tucker.
Thank you, Phil. The purpose of today's webinar is to discuss the overview of protection for some very specific industries with regards to the coronavirus and COVID-19. I'd like to start out by talking a little bit about hazard recognition and the different types of risk that you may be involved in at your workplace. The Occupational Safety and Health Administration has divided the job task into 4 specific risk exposure categories: very high, high, medium, and lower risk. With that, the purpose of the presentation today will focus predominantly on the lower and medium exposure risk categories. But what I'd like to do is briefly go over all 4 of these categories so you know what they entail. The very high exposure risk, first of all, are those employees and employers that have exposure to known or suspected cases or sources of SARS-CoV-2 or COVID-19. Specific medical, postmortem, or laboratory procedure workers fall in this category. That certainly would be healthcare workers, whether they be doctors, nurses, paramedics, etc., healthcare and laboratory personnel that may handle specimens, and morgue workers that may perform autopsy that would probably involve aerosol-generating procedures. The next category is the high-risk category, and those are for those employers and employees with a high potential for exposure to a known or suspected source. Workers in these categories are the healthcare delivery and support staff. Those are staff who may enter a patient's room that are exposed to known or suspected COVID-19 patients. Medical transport workers such as ambulance and vehicle operators, and mortuary workers that are involved in preparing the bodies for burial or cremation. The 2 lower categories, which are what we predominantly will talk about today, the medium exposure risk, are jobs that require frequent or close contact with people who may be infected but are not known to have or actually have the case or suspected of COVID-19. Those are those employees and employers who may have frequent contact with travelers that may return from an international location or with the general public, for example, schools, high population density work environments, and some high volume retail settings. Our lower risk categories are jobs that do not require contact with people known to be or suspected of being infected with COVID-19. They're expected to have minimal occupational contact with the public and other co-workers, such as those remote workers working from home, office workers with infrequent close contact with co-workers, customers, or public, manufacturing and industrial facility workers, healthcare workers who only provide telemedicine services, and long-distance truck drivers, to name a few. So the overall presentation will be an overview of specific industries for protections for these employees. So I'd like to start with prevention for everyone. It's something that you've heard many times over the last couple of months, but it's an expectation if we're going to stop the chain of the coronavirus that, first of all, everyone frequently wash your hands with soap and water for at least 20 seconds. And if that's not available, to use an alcohol-based hand rub. And generally, it's 60% alcohol is what we're looking for in this alcohol-based rub. Obviously, avoid touching your eyes, nose, or mouth. That also should be added in there. Your cell phone. Avoid close contact with people who are sick. Wear a face covering and maintain that 6-foot distance. So with regards to the face coverings, let's talk a little bit about respiratory protection in general and the different types that we're seeing out there. We'll start at the lowest level, which is the face covering. Those are anything from the homemade masks that people will wear that you see in the grocery stores, that you see in public, the 3-ply masks that go over the ears that are similar to the surgical mask. Those are all types of face covering. OSHA requires that any employer that has an employee performing tasks that require the use of respirator use a respirator that is certified by the National Institute of Occupational Safety and Health, NIOSH, to be an N95 certified mask. These face coverings and the surgical mask are not certified by NIOSH, so they're not required to provide a higher level of protection than what we would see for those folks that are into the medium and to the low risk exposure categories. The next step up is a very similar type covering that we see, particularly with this COVID-19, that we're seeing an awful lot of face coverings or masks that are called KN95s. The K is a Chinese designation. It has some protection similar to the N95 certified by the National Institute of Occupational Safety and Health, but they do not have that actual certification. So KN95s are just another higher level of protection of a face covering, but they are not considered a respirator. And then when we're looking at our higher risk folks that are dealing with employees that are actually working in those categories, they're using the higher level of protection, a NIOSH certified N95 respirator, which looks very similar to the surgical mask, except they have 2 straps. They don't go over the ears. They go over the crest of the head and around the neck, or they could use a even higher level of protection, a elastomic respirator with cartridges, or a powered air purifying respirator. So the general rule is when we're in public, maintain a 6-foot distance. When we cannot, wear a face covering. So the first category that I would like to talk about is our retail establishments. That would fall anywhere from the grocery stores that we talk about to department stores, convenience stores, and the like. And the state of Connecticut has allowed the retail establishments to stay open to service our population, and at the same time, they have required that the occupancy be capped at 50% of what their normal occupancy rates were, and that demarcated 6-foot distances are marked, particularly in checkout lines. The grocery stores have even went to a larger method of controlling the public by asking that only one member of the family comes into the store, that they actually, to determine that 50% capacity, that they actually count the number of people that come in. We've seen grocery stores and some of our retail establishments with lines out there. When one person goes out, another one comes in to maintain that 50% capacity. Obviously, in every situation, you'll see that first bullet, encourage workers to stay home if they're sick, and to provide a place to wash their hands with alcohol-based rubs containing at least 60% alcohol. There's an expectation that regular housekeeping practices, including routine cleaning and disinfecting of surfaces, be maintained. The Environmental Protection Agency has a list, they call it List N of approved cleaning chemicals, and there's 405 different chemicals that are on that list. They're everything from the Clorox that you normally would see to the Lysol to pretty much every type of cleaning chemicals that you could imagine. If you can find it on the shelf, it's probably going to be on List N. The retail also requires that the employer establish innovative approaches to their facilities, and that's where you see particularly the plexiglass partitions at the grocery stores, moving workstations so every other cash register is open, providing drive-through window or curbside pickup, and the like. So you could see the different requirements that's under the retail establishments. Workers are required to wear a mask over their nose and their mouth to prevent them from spreading the virus, and it also helps to protect them from members of the public that may sneeze or may inadvertently cough at the same time. The other aspect of that is that workers are encouraged to report any safety and health concerns, and it's the employer's responsibility not to take any action against any employee who raises safety and health concerns in the workplace. Employees have the right to not only to file a complaint with either the Connecticut OSHA if they're public sector workers or federal OSHA if they're private sector workers, but also to file discrimination complaints. So the goal here is not to have any of those discrimination or health and safety complaints to be filed, but to have the employer to become progressive to make sure that their employees are taken care of. With regards to construction, again, the first couple of bullets talk about the same almost in every environment. Encourage on workers to stay home if they're sick and to wear a mask over their nose and their mouth. Generally, to continue other normal control measures, including the personal protective equipment that they would normally be wearing on that construction site. There's an advice to any worker to avoid their physical contact with others and to increase their personal space to at least 6 feet whenever possible. There are tasks in construction when that's not possible, and at that point, it's the most important to make sure that the respiratory devices such as the mask and the mouth coverings are worn at all times. Work trailers, when they're used, should maintain social distancing at all times when inside the trailers. There's an added requirement that workers are trained on how to use and wear and to take off their protective equipment. And again, the personal hygiene, the soap and water for hand washing and alcohol-based rubs with the 60% alcohol, and using cleaning chemicals from List N will apply also for this environment. As far as tools and equipment that must be shared, every time that the tool or a piece of equipment is not being used or finished being used by the worker, they need to be wiped down prior to reuse by someone else. And any time that the tools and equipment are being cleaned, any manufacturer recommendation that they may have for techniques and restrictions need to be consulted before they get wiped down so they're not degraded. Any in-person meetings such as toolbox talks or safety meetings should be limited, and the number of workers in attendance should also be limited using social distancing practicing. Toilets need to be cleaned and disinfected on a regular basis. Construction sites have that requirement that portable toilets are provided, so therefore they need to be maintained on a regular basis. Hand sanitizer dispensers are required to be filled regularly, and the door pulls, the toilet seats, and anywhere that someone could touch needs to be disinfected on a regular basis. The next category is manufacturing, and these have their own unique set of concerns just because they're designed to manufacture a particular item. In this case, we're asking that the employer take a look at flexible work hours if it's feasible, staggering the work shifts, maybe not everybody working on a 7 to 3 or an 8 to 4 type shift, but staggering those shifts so we can get all our employees working, but at the same time we can minimize the number of employees that are in the work area at one particular time. Whenever possible, to practice sensible social distancing and maintain our 6 feet between our co-workers where that's possible, and where social distancing is challenging, limiting the duration of those activities, maybe moving the workstations, creating distance or installing barriers between the workstations. Again, protective equipment that are required to be worn other than the masks that we talked about earlier. Workers need to be trained on how to properly use and maintain their protective clothing and the equipment. Ensuring that all the masks are over their nose and mouth to prevent the spread. Encourage our respiratory etiquette and discouraging workers from using other workers' tools and equipment. The cleaning chemicals from List N from the EPA, again, would take effect in the manufacturing industry. Washing our hands with 60% alcohol if we don't have soap and water is also critical, and providing disinfectants and disposable towels or towelettes that workers can use to clean work surfaces. The next category is our restaurants, and again, encourage workers to stay home if they're sick, to avoid any direct handoff when possible, display any type of door or sidewalk sign with the services available. Make sure that the customers know that it's takeout or curbside, that there's clear instructions for pickup and hours of operation. Reserve any parking spaces near the door for curbside pickup only. The employees could park in farther away from that main entrance. Train our workers in proper hygiene and require them to wear a mask over their nose and mouth to prevent the spread of virus. Obviously, to provide a place to wash hands in alcohol-based rubs. Cleaning and disinfecting the surface with the type EPA's List N. Maintain our sociable distancing and marking the 6-foot distance with floor tape with this pickup lines. In restaurants, is a strong encouragement for customers to pay ahead of time, either by phone or online, or to move workstations to create more distance. If the customer cannot pay ahead of time by phone or online, try to get them to either have a check or to pay with exact change whenever possible to minimize the amount of handling of cash that would go on at that point in time. Package delivery workers are the last category that we're going to talk about today. Again, encourage workers to stay home if they're sick, establish any flexible work hours where it is feasible, to practice any sensible social distancing, maintain the 6 feet between coworkers, minimize any interaction between any drivers and customers by leaving deliveries at the loading docks or at doorsteps or locations that do not require person-to-person exposures, and certainly to encourage respiratory etiquette, including covering any coughs or sneezes. Again, some of the same recommendations that are for the other environments that we talked about with personal hygiene as far as washing and cleaning, discouraging from using other workers' tools and equipment. The most important, again, is to wear the mask over their nose and the mouth to prevent any spreading of the virus. I put 2 references on the website that are a good tool for anyone to use. OSHA.gov has a very robust program and information that's on their website. OSHA.gov would be the website, and there are several different categories for not only the items that we've covered today, but many more aspects relating to COVID-19 and where most people seem to gravitate toward when they're doing research is for the Centers of Disease Control. The CDC has a plethora of information on their website for protective equipment, for respiratory protection, for cleaning, for sanitizing, for recommended guidelines, and the like. And that concludes the presentation for today. Thank you.
Thank you very much, Ken, for those insights on how employers and employees can create a safe work environment. Please, if you have further questions, do not hesitate to reach out to Ken at the CONN-OSHA, or please feel free to contact me, Phillip Montgomery, at CBIA. I thank you for joining us today. Have a good one.